Tolson. I am the One Stop for Help Coordinator, and I'm so excited to be here to celebrate the exciting expansion and programming plan for One Stop Centerville. One Stop Centerville opened 10 years ago this coming July and serves more than 8,000 residents annually. The facility currently encompasses community space for events, workshops, classes, and other enrichment activities for this residents, along with the Centerville branch of the Gwinnett County Public Library. Across the sidewalk sits our Centerville Senior Center, which opened its doors in 2017. That building serves as our congregate senior center for older adults aged 60 and older for social programs, nutritional meals, and also other involvements for aging in place. In 2021, Health and Human Services launched its One Stop for Help, a comprehensive program that serves as Gwinnett's social services initiative across the community. This program helps identify and address basic needs and issues such as food insecurity, homelessness and emergency housing, and utility and rental assistance, and other targeted social needs that are currently emerging or may emerge in the future. That mission has received a significant boost thanks to Congresswoman Bourdeaux. Gwinnett County has recently been awarded the Federal American Rescue Plan Act allocation for its One Stop Centerville facility expansion and startup operations for $25 million. It was much needed and much appreciated. Now it's my pleasure to turn today's program over to Congresswoman Bourdeaux.
All right, thank you, Dwayne, and I really appreciate the great work that everybody does here. You probably can't even see me over all the small person. So one of my first acts as a member of Congress was passing the American Rescue Plan. This law provided critical resources to state and local governments, and the investment in projects like the One Stop Centerville is an example of this legislation's success. Under the American Rescue Plan, Gwinnett County received $181 million to help the county address the ongoing pandemic and the economic fallout. I commend Chairwoman Hendrickson, Gwinnett County Commissioners, Jasper Watkins, among many others, for their commitment to achieving an equitable recovery by investing $61 million in equity-focused services, including the $25 million in the Centerville OneStop Shop. I was proud to bring this money home from Washington and will continue to fight for the people and the priorities of Gwinnett County. Too often, communities like South Gwinnett are left behind and are not given the resources they need to thrive in our health system, our financial system, and in our economy generally. This is why this facility is so important. It will expand access to critical services that are a part of our community that needs them. With the expansion of this facility, more people will have access to health care, more children will have access to early childhood education, more families will be able to get the mental health care and family services that they need. With the passage of the Infrastructure Investment and Jobs Act, we will have even more opportunities to fight for our federal tax dollars to come right back to Georgia 7. My team and I are committed to doing just that. Just last week, I convened local governments in Georgia 7 with representatives from the Georgia Department of Transportation, the Atlanta Regional Commission, and the Atlanta Region Transit Link to discuss how to best take advantage of the increased funding and resources included in the Infrastructure Investment and Jobs Act. Delivering as many federal resources as possible to spur economic growth and to promote equity in our communities is a top priority for me in Congress, and I'm proud to be here today with our partners in Gwinnett County government. I want to just add to the end of this more of a personal note that as we had the COVID task force and as members of the county commission and public health agency sat on that, we would put together maps of where services were available, where people could get things like vaccines. And we would always notice that there was this sort of dark area down in South Gwinnett where we knew we needed more services. And so I am so proud of Commissioner Nicola Hendrickson, Commissioner Jasper Watkins, who represents this area, and their advocacy for this area and bringing this wonderful one-stop shop to this community. With that, I will turn it over to Nicola Hendrickson to outline some of the services that will be provided here.
Well, good morning, everyone, and thank Bourdeaux, for joining us to celebrate the service expansion happening here in the southern part of our county. The southern area of Gwinnett County has seen an increase in population, and with that increase, there is a greater need for services, resources, and programs to help support Gwinnett residents in basic needs. This is the vital funding that we will use will ease the burden of many of our residents in South Gwinnett, as you had already recognized. The expansion of the One-Stop Centerville location will include new facilities for our partners such as Gwinnett, Newton, and Rockdale Health Departments, that's GNR Health Departments, Viewpoint Health, and Head Start. This expansion of county services in South Gwinnett will provide programs like creating safe, livable, and healthy communities, mental health, family services as we sustain the Gwinnett standard of excellence in providing much needed resources to this area. If the community helps a child when she's young and also supports her family, she can grow up to be strong, resilient, and a contributor to her family. I know this to be true because I was once a child in a family that needed assistance. The community stood by us and we persevered, and now we can pay it forward. This One Stop will continue to provide programming that reaches youth, families, seniors, to meet the needs of Centerville and surrounding communities. The ARPA allocation will fund an expansion of this facility with 42,000 square foot multi-level facility that will provide organizational space for public health, Viewpoint Health, and Head Start to serve the people in need. Each of these partners plays a vital role in building healthy individuals and a healthy community. Head Start programs promote the school readiness of children ages 3 to 5 and engage parents of other key family members in positive relationships with a focus on family well-being that is essential to early development and growth of child and the community at large. The Gwinnett, Newton, and Rockdale County Health Departments protect and improve the health of those who work, live, and play in our community, and continually strive to meet the varied health needs of residents and visitors. Viewpoint Health is a community behavioral health center using a team of psychiatrists, nurses, licensed counselors, and social workers, as well as other professionals to treat and support individuals with mental illness, substance abuse, and intellectual and developmental disabilities. Our One Stop for Help program uses community navigators who will have office space at this location to help people navigate systems and processes to meet such needs as hunger, homelessness, utility and rental assistance, and so much more. Gwinnett County is committed to the ongoing development of quality service, programming, and resource support through the county. ARPA funds, which are so critical, are helping Gwinnett accomplish this mission. These public spaces are part of the foundation to build and strengthen relationships with health and human services and social service community partners to best address the needs of that community. And these enhanced partnerships are essential to provide core service and foundation to connect residents with the resources they need. And now I'd like to turn it back over to Congresswoman Bourdeaux to share any closing thoughts.
All right. Thank you so much. I think pretty much that was everything. We're just very proud of this facility. And again, it came out of, I'm sure there were many converging forces, as there always are, but certainly the COVID-19 task force, we identified this repeatedly as an area where there was a lot of need. And originally I had advocated for a very large vaccination spot in this area because we knew this was a place where we were not getting those vaccines out. And so that kind of evolved into this facility, though I'm sure, again, as with many projects like this, there are many paths leading to it. But it was one of the reasons I was so very proud that we are putting this in place here, and I've been able to help in this way with the federal funds. So with that, I will wrap up and we can take any questions. Yep.
Congresswoman Bourdeaux, kind of on a similar note, obviously you guys have been pushing that Medicaid lookalike program.
Yes.
A lot of people who rely on facilities such as One Stop
Yep.
need access to that kind of care. Where are you guys at with that? Obviously, Build Back Better was supposed to include that. It's kind of stalled right now, or?
I am not planning on giving up on expanding Medicaid through whichever path we can make that happen. And and if we can get it done at the state level, if we can get it done at the federal level, that is just my #1 priority in Build Back Better. I don't think it's dead. I think we're just going to have to go back, dust it off, reconceptualize it, keep pushing it through. But I will note that even in scaled down versions of Build Back Better people are talking about, it prominently features the health care reforms that are in that bill. If we had Medicaid expansion, it would be a game changer for areas like this, for our mental health community, for people who struggle with mental illness. One of our huge challenges is we cannot get them consistent health care because they don't have health insurance. And they aren't holding down jobs, right? So they don't have the income that you need in order to purchase the health insurance on the exchange. They're too poor to get health insurance on the exchange. So it is extremely important for this, and I will advocate for that until it's done. Yep.
Access to Andrew Snorton Status Network. Access to resources is always key, and looking at how the county is growing in regards to population, one of the key things you mentioned in regards to the Head Start piece, schooling, reinforce why it's important to have this here.
So, as I mentioned, when you look at where services are deployed around the county, they tend to be in other parts. And so one of the things that we wanted to do is make sure that we are serving this community. It's grown a lot. And so really the needs have grown quite a bit. But also, I think there's a lot of growing awareness that Gwinnett County is a county of 1 million people now, or getting close to that, right? And we just need more services that typically you would find in communities like the city of Atlanta, right? We just have those kinds of needs here, and we need to address them. And being able to have a very robust public health infrastructure all over the county, but concentrated in areas where there really is that deep need, is just going to help us address so many problems. It will be very, very important if we have another wave of COVID, right? You'll have people here where the local community, where they can come, they can get vaccinated, they can get the health care that they need. It will be very important for, obviously, the mental health services. It'll be very important to have a child care facility that's convenient to people here. And one of the things I really commend the new Board of Commissioners and the new Chairwoman on is recognizing those needs and deploying them strategically around the county.
This may be a question for Nicole or Jasper, but if you could talk about the need to provide more services in the STEM area, because we've historically seen a lot of services put into, say, Norcross or Lawrenceville or the West part, but not.
That's a great.
And it's obviously not just healthcare, but also
Jasper,
so much transit and everything.
So the county's Health and Human Services does have sites in Norcross. We have a site in Beaufort. We have Lawrenceville, access to Lawrenceville. And many of those sites are strategically placed based on those populations and provide specific programming dedicated to those communities. This site, which houses our library and our senior center, which is right next door, as well as some community classrooms to open up the door for specific programming, but we still lacked access to those basic needs services, as Carolyn Bourdeaux alluded to. Having that robust public health infrastructure on the south end of the county is what was missing. Access to mental health resources, access to Head Start and early learning. These are all services that are centrally located in the county, but they're not accessible to those who live on the south end. And what we've been hearing, and Commissioner Watkins and I have been hearing during, not just our campaign, but just in general, when we talk to communities and constituents down in this part of the county, their #1 issue is access, resources. We feel like we are a forgotten part of the county. While services are always pushed in the center of the county, Lawrenceville, Duluth, the needs of the southern part of the county often get overlooked. And so we really wanted to be intentional about addressing some of those gaps in service delivery to have it strategically placed in the south end of the county. And it's also based on the data too. When we look at the population, majority of this district is African American, and there are also higher disparities of health, literacy, issues that are impacting some communities of color. We also wanted to be strategic about addressing some of those health disparities by positioning these resources in this southern part of the county. So it's a little bit of both the outcry from our constituents, but also basing it on data as well.
Jasper, would you like to?
Oh, and if I could add, you have to understand that when you look at the southern end of the county, it is more suburban than the majority of the county. So what you have is suburbs that are trying to effectively address urban issues. And because they're pockets, it's difficult for them to address those. When you come from a larger suburb and you're looking for healthcare or access, the first real place you have is Eastside, which is now Piedmont, to come to. So to have access further down and to get those suburbs to kind of get a collaboration together and then effectively address the urban issues would be beneficial. And that's what we're starting to do now. That conversation is starting to happen. And that's what we want to grow, that conversation. And then we can better meet those urban needs with all of the various suburbs out in South Gwinnett.
So will this be a separate facility from this building? The project you guys are talking about with the expansion, or will this be within this facility?
This site is going to be expanded. So we will be building this site out to push. So there's a whole plot of land that is in the backyard of this facility that abuts the lake. That is going to be expanded out. We're also going to add another story to have office space. There is also going to be pushed out to add the Head Start. There's also going to be a connecting point from this facility to our senior center next door. So there is going to be a covered access point so that these two facilities can adjoin without having to walk out of one, then walking to another.
What's the timeline that you guys expect?
We are working on that right now. Our staff, our leadership, Regina Miller is the Deputy Director over Health and Human Services, and of course we are working with our facilities and support services and engineering to work out a timeline. There is proposed site plans that are available that we have looked at that we think would work for this site, but as far as the timeline, those details are still being ironed out. The plan is, and our hope is that it is done, that is completed this year.
The whole project, or just
the entire project for this site.
All right, great, good deal. Thank you for coming.
Oh, one more quick question, actually. Is there matching funds that kind of involved?
We will get you the breakdown of the funds. We are leveraging ARPA dollars as well as funds in our capital budget to help support this. And of course, when you talk about staffing, of course, that's gonna come out of our general fund, but we're also relying on the support of our partners. So when they do fill in the office space to house their satellite offices, of course, they will be providing the staffing and manpower for those. But in terms of management of a facility, of course, we will have to leverage our general fund dollars to hire staff to manage the facility as a whole.
That $25 million, is that just the federal funding portion, or is that the whole?
That is the whole cost of it, and as I said, I'll get you the breakdown of what percentage from ARPA versus capital that will be used for this site.
Okay.
Yep, we'll get that to you.
All right.